All right. So good evening, everyone. Thank you for joining us this week at our workforce town hall. This week we have a special guest, Dr. Healy, who is the Chief Advisor for Workforce Development for the administration. And with us as well, we have some of the Prince William County delegation, along with my very own state senator. So why don't we go ahead and go and do introductions?
I'm Jeremy McPike, State Senator for the 29th Senate District. Delegate Guzman, thanks for helping to host this tonight. I know lots of questions we've received from constituents, and we've been working through a number of different challenges. And thank you for Dr. Healy for joining us tonight. The 29th District is half of Woodbridge, Dale City, stretches out to Manassas and Manassas Park, and almost in Prince William County to 66. So glad to be here and joining everyone tonight.
Hi, this is Delegate Jennifer Carroll Foy, and I represent the 2nd District, which is Prince William and Stafford. I, too, would like to thank Delegate Elizabeth Guzman for organizing this town hall, and Dr. Healy for being on the call also, and look forward to a lot of information to be shared with our constituents, because a lot of questions regarding this issue has come up, and we want everyone fully aware and prepared for any type of benefits that we have to help them through this crisis. So thank you.
Hi, this is Delegate Hala Ayala representing the 51st District. Thank you all for joining the town hall tonight. Thank you, Elizabeth, for hosting. And also like to thank my colleagues for bringing information about workforce issues, as well as issues as we're going through the pandemic or experiencing the pandemic. I want to express my appreciation to Dr. Healy for joining us tonight. I know how busy she is, but to address the issues of our Commonwealth's workforce during this time on behalf of the 51st District, I just really appreciate you being here tonight.
And I'm Dan Helmer, the delegate for the 40th District, which is Southwest Fairfax County and Northwest Prince William County. I'll echo my colleagues' comments to thank Delegate Guzman for setting this up, Dr. Healy for being here, and really looking forward to the discussion and answering any questions you might have.
All right, thank you for joining us. As you probably know, we're getting ready tomorrow to go to Richmond to our video session. We will be practicing social distancing and just making sure what we can do to look at the budget amendments and look at some amendments that the governor has given us to vote on tomorrow. So why don't we start with Delegate Hala Ayala giving us an explanation of the latest Executive Order 57. Delegate Ayala, the floor is yours.
Thank you, Delegate Guzman. As we've seen several executive orders roll out, Executive Order 53 was basically establishing the classification of essential, what do they call this, essential businesses, and some measures for social distancing. As we ramped up, we went into Executive Order 55, which increased essentially just the penalties for not following these rules, and also clarified what enforcement and that Executive 55 would carry, which was a Class 1 misdemeanor if you didn't follow the rules. And Executive Order 55 has to deal with our increased demand with healthcare. Because of the pandemic, the EO deals with licensing regulations with medical professionals, as well as expanding medical coverage. One of the biggest things that it does is to allow healthcare practitioners like physicians or clinical psychologists who have licenses from other states and are in good standing to provide services to Virginians during the pandemic. This EO will also allow interns, residents, and fellows with temporary training licensures to practice in hospitals, and will allow senior 4th-year medical students to join hospital workforces. So this will go a long way in bolstering our medical workforce to ensure that we're able to address as the pandemic increases our curve, and we're able to rotate some of those individuals who are on the front lines because it is cumbersome. They have long hours so that we can fight against this pandemic. Additionally, the EO will allow healthcare practitioners, including those out of state, to provide telehealth services to patients. So this applies to any valid reason to a patient who needs to see a doctor. Well, if it's just a wellness check, a follow-up, et cetera, regardless of what it is and what it's related to, you're able to access those services. And then the expansion of our healthcare services and staff in this executive order will go a long way in protecting our health and safety of our workforce, as well as Virginians. So we are in the thick of the storm, and having these wonderful individuals that are frontline workers put their lives on the line as well to service Virginians is greatly appreciated. Back to you, Elizabeth.
Trying to unmute. Okay, great. Hard to go back to unmute back again. Delegate Helmer, Delegate Carol Foy, Senator McPike, is there anything that you guys would like to add before I introduce Dr. Healy?
I'd just like to quickly add, we appreciate constituents reaching out to us. That's what we're here for. All of us to try to respond to different issues. If we don't know the answer, we're going to help to track it down. And so I just appreciate, I think we all do, Dr. Healy being on the call, who's really on the front lines at coordinating with the federal government, the governor's office, and so many other things. So we appreciate her valuable time during this effort.
I'll just echo everybody's comments, and if folks, if my constituents who are on, if you do have questions and something that's not answered tonight and want an answer, you can reach out to anytime at deldhelmer@house.virginia.gov. So, and it's the same format for anybody else on the call. So thank you all for being here, and looking forward to questions and answering them.
Same. So everyone's pretty much said everything. So my office can be reached also. Quickest way is my full name at gmail.com, Jennifer Carol Foy at gmail.com. And we'll get back with you immediately. And we've actually had wonderful people from VEC be very responsive to a lot of the questions that we've gotten thus far. So thank you for everyone for being here and listening and being on the call.
All right, thank you. So just a little bit about the format of what are we gonna do tonight. So we're gonna go ahead and Dr. Healy is gonna answer the questions that were sent in advance. And as soon as we are done with the questions that are done in advance, then we're gonna go ahead and share the questions that are sent through the Facebook Live or via email while we are here. So just please, if you have any questions, you feel like didn't answer everything that you needed to know, do not hesitate to post your questions right here on the Facebook feed while we are doing this town hall. So Dr. Megan Haley serves on the Governor Northam cabinet as his Chief Workforce Development Advisor. As the Commonwealth's highest ranking workforce officers, she oversees a range of regional, state, and federal programs that connect Virginians to the skills, training, and opportunities they need to thrive in the 21st century economy. In addition to her partners within government, Secretary Haley works closely with Virginia labor and business community to identify and fill vacant jobs in high-demand sectors. Having started her career as a science professor at Patrick Henry Community College in Martinsville, Secretary Haley keenly appreciates how education can change lives and communities. Prior to joining the Northam administration, she served as the Virginia's first director of STEAM Age under Governor college system as assistant vice chancellor for academics. Secretary Megan Haley is a proud product of the Virginia Public Schools, holding a bachelor's degree from Virginia Tech, a master's from Virginia Commonwealth University, and a doctorate from Old Dominion University. So Dr. Haley, thank you so much for joining us tonight. And before we go and start with the questions, why don't you start sharing with us how busy you've been lately. We appreciate all of your check-ins at least 3 times a week. So please
Great. Thank you so much, Delegate Guzman, for that introduction. It's awesome to be with the star cast here on this town hall. I appreciate all the legislators. I know they're going to be very busy tomorrow, but it's obvious how they support their constituents by being on a call the night before. They're constantly working. I really appreciate it. It's also been great during this COVID-19 crisis to receive the support from the legislators and feedback on some of the things that we're doing in the state. So it's been kind of every hour, I think something changes, if it's in the employment world or the health world. And so they're definitely up to date, and they're, I know, supporting you as constituents, because there's a lot of people that are looking for the facts. You know, they're scared. This is a health crisis, but we're actually it's going to turn into an economic crisis also. And so it's great to have that support. So as it's interesting when I hear that bio, I need to update it, because I think during this COVID-19, my job has shifted a little bit. You know, workforce is really what I was for, with record unemployment rates at 2.6%. We just actually saw in February. My job was to make sure that businesses could fill their jobs and making sure that all Virginians have the skills to get the jobs. But I also work closely with the Employment Commission. It's actually tucked under me in my secretariat, as well as Department of Labor and Industry. So I do all things workers. And that's workers who need the skills to get the jobs. That's workers on the job for discrimination or safety on the job, as well as workers who do lose their job due to layoffs or crises like this, and to make sure that we have the right things to support these workers. And so I'm going to talk a little bit about the two first things about workforce. We're constantly looking for healthcare workers. That has been our largest challenge. And especially long-term care, and also our health surges. And so looking at how do we bring more people into that pipeline right now, especially long-term care, that we've seen a lot of staff that have not shown up to work or left. So any nursing homes, assisted living. And so we're working on backfilling with workers, doing training programs in the healthcare space, as well as looking at potential surges in our hospitals during this COVID-19. Also, workplace safety has been a huge concern, that some people are scared to go to work. And so we're making sure that we are providing guidance to businesses through our Department of Health, from our Virginia Occupational Safety Health Office, our VOSH office, which kind of reports up to OSHA at the federal level as well, and working with CDC guidelines. But really what I want to talk about today is about unemployment. That we have seen in the first 4 weeks, we've seen over 400,000 people that have filed for unemployment. In the first 3 weeks, this is kind of a statistic, the first 3 weeks after the COVID-19 crisis, we had more people file for unemployment than we did the last 3 years combined. We went from a staff at VEC of 1,600 workers during the recession, now in half. So we only have about 800 workers, and a lot of those workers weren't even doing unemployment. They were moving over to the workforce side, doing job services and interview coaching, and not really working on unemployment insurance benefits. And so that's where we started in February, is that we're definitely a reduced staff. And so when this crisis came, where we had a system that probably was not ready for this. And so I think the Virginia Employment Commission done a fantastic job over the last couple of weeks to build out a 20-year-old system, to add a new portal for eligibility that I can talk about. And I know the call lines, it's been a long wait, the website's been slow, but I think over the last couple of weeks, they've actually done a fantastic job with half the staff they had only like 10 years ago. And so let me talk a little bit about the timeline and eligibility for unemployment, and then I'm really excited to answer some of these questions. Unemployment, the rules have changed almost daily. So if you don't think you're eligible for unemployment today, you might be eligible tomorrow. We are constantly asking questions to the federal government. I am the Governor Northam's liaison to the Department of Labor. So we're constantly asking questions. How about this person or this situation? So hold tight. So if you have been denied unemployment, make sure that we keep updating you with information. So unemployment's usually, in the past, it's been for anyone who's been laid off from a job. It could be a temporary layoff, or it can be a permanent layoff. And so it would follow, and it would only count for about 80% of workers, because your employer has to pay into our unemployment insurance system, and that's through a payroll, almost like a payroll tax. And so after, if you were laid off from a business, then you can apply for unemployment up to 26 weeks. And so we changed those rules during COVID-19 with the first Families First Corona actually expanded the benefits. So if anyone was quarantined because, or a health professional said you have to stay home, you can't go to work. Also, we saw at the same time that schools closed. So we had a lot of parents that did not have childcare. And so we expanded eligibility for that population, as well as many that are temporarily laid off, like our restaurant workers who might are still going to probably go back to work. Because of just the huge issues, that's about 83% of people we can match payroll data to that could get it. We had a huge group that were really struggling, our independent contractors, gig workers, they also call 1099s. And so the federal government also expanded eligibility as well as the amount of benefits. So a person on current unemployment at like last year, the highest someone could receive is $378. Because of the CARES Act, now they get additional $600 for 4 months. And so that's to July 31st. And so somebody can receive up to $978 a week. That's around $24 an hour. It's about, close to the median income of Americans. And so that's where the number came from. They also expanded benefits from 26 weeks to 39 weeks. So additional 13 weeks. And then also open eligibility to independent contractors and the gig workers, like I said, and that's under pandemic unemployment assistance. And so what the challenge was is after the CARES Act was signed on March 29th, Virginia actually didn't even get guidance to what that even looks like until April 6th. And then we had to build a brand new system because we've actually never given unemployment benefits to people we did not have payroll records on. And so that new system came on board Saturday officially. We've already had tens of thousands of people successfully apply. And what it takes a little longer for independent contractors, since we don't have data on income, we have to have different types of documentation. If it's tax records, we're trying to be pretty flexible on what that documentation is. 1099s, even taking profit loss, even a letter from your accountant that said you have some kind of income, and trying to figure out what the formula is. And the federal government gave us a formula that we crunched the numbers, and we are excited to announce that we were going to back pay to when the CARES Act was signed, but since the governor shut down many businesses on March 15th, we're actually going to give an additional 2 weeks of back pay all the way to March 15th. So we decided, because I know a lot of these independent contractors have been struggling, they've been waiting for this new system to come on board. I'm sorry it did take a while, but it was building a brand new system from the ground up with lots of different rules, and the rules are changing every day because we have individuals that we really want to give benefits to, but we always have to check into the Department of Labor and say, hey, can I give this person a benefit? Or what about this situation? And then we have to change the rules. And so that's just a little bit of the background. So I appreciate everyone's patience. I know we get over 10,000 emails a day to the VEC. We can take 3,000 calls at a time. So if you've called and it sounds like you got hung up, that means there's already 3,000 people waiting in line on the calls. And we expanded our call centers, 2 new call centers. We have now a third-party call center that came on board on Monday. And we're trying to increase our staff at least 20% just to answer all your questions and concerns and make sure the system's operational. So excited to hear your questions and give some more answers around some of the concerns around unemployment.
Awesome. Thank you, Dr. Haley. I mean, this is historic. We never had unemployment for independent contractors. So that's amazing. So the first question here that I have is, what are the main reasons why people are ineligible for unemployment benefits?
So with the new expansion of independent contractors, sole proprietors, 1099, we definitely increased the number of people that can get benefits. I will tell you, if you quit your job, you do not get unemployment insurance. I think that's a rumor going around. I know these benefits with the extra $600 a week are amazing to workers, but we've actually had a lot of people we've called that have quit their job. And so your boss, we do check in with your employer and check out the situation about did you leave the job yourself or did you actually temporarily get laid off? And so we are checking on that. It does take us a little while So that is one of our largest reasons. If somebody has a good cause, I mean, I've heard stories of these great essential workers. They might be older, 70 years old, working in this grocery store, and they just cannot work. It's for their health concerns. That is a good cause. So you can quit your job and go on unemployment benefits. But just because you feel like you're gonna get more on unemployment, you cannot actually get these benefits. And we are checking on that as well. We're also looking in some examples that we're still not sure of. I got a call the other day. I worked 3 weeks last summer as a babysitter. Do I get unemployment? So we're checking in because the guidance says you have to associate with workforce of some way. It doesn't really say the new expansion, how long that is, what does that look like? And so we're still receiving guidance on that. Temporary workers, how long do you really have to work? How much? And then what's that documentation? Because we're trying to be pretty flexible in documentation. When in doubt, we're trying to move people as fast as we can to pay out benefits.
Okay, thank you for that. The next question, how many weeks will benefits last?
So benefits currently are 26 weeks, and now they move to 39 weeks. And so they are expanded. We will say when that business reopens, that you're required to go back to work. And we've already seen some businesses open and some people asking if they really have to go back to work or not, but it's part of the requirement. And employers do reach out to the Employment Commission and say, yep, we opened back up. This person is to be at work. So it would be all the way to, we also know many businesses are closing. It's sad to say some of these restaurants are not. And so someone could be on benefits up to 39 weeks.
Thank you for that, Dr. Healy. What are the timelines if I was for getting approved on unemployment? So, and is it, 1 week, 2 weeks, or how is that communicated to me? Is it text, email, or both?
So there's different ways. So everyone has to actually apply for unemployment through the main system. If you check the box, lack of work, and we know it is because the business is temporarily closed, we check you to the payroll system, and we know we have your payroll data because your employer paid into the unemployment insurance trust, then you should actually within a week get benefits. You will receive in the mail a PIN number, but we actually are trying to get benefits out, and we can talk about the PIN number. We've changed it up a little bit to make it easier for the claimants. If you do not qualify because we don't have the payroll data on you, very similar to what I said about the independent contractors and the gig workers, then you are going to get a notice that you are denied because we have to go everyone through the first system first because we rather check you off on that benefit system. It's a lot easier. And then we send you a text message. If 90%, we know we have cell phones on, 10%. We do robocalls to leave voicemail saying, hey, you were denied. Now you need to go onto this new portal, and it's called the Pandemic Unemployment Assistance Portal. And that's where you go in. It's a Gov2Go portal. And then you go on there and you fill out the information. Like if you already put your bank information about direct deposit, it'll move over to that portal as well. And that's where you put your supplemental documentation. Since we just started the new PUA portal, we hope to get benefits out within a week, but it probably might be 2 weeks. And so if there's more documentation needed to support your application, then that's what takes a little longer. But we've actually had many people go through to get their benefits within a week if they just check that lack of work box.
Thank you so much for that answer, Dr. Healy. One of our constituents asked, if they're already getting unemployment in Virginia, are they eligible to receive an additional payment from the federal government? And if so, who pays for that?
Yes, if it's still COVID, it depends on when there's certain dates that we locked in of when, if someone was on unemployment in December. And then there's also cases that you can say, hey, I was unemployed, but now I really can't get a job because now our unemployment rate is probably 13%. Then we're looking at case by case basis, or I was unemployed and then now I have to stay in with my kids. And so we're looking at what that expansion is. And then there's certain particular dates to get the $600 extra that's given over the 4 months. And so sometimes we look at those cases but anyone pretty much when COVID started at the beginning of March, if they do qualify, they are going to get the additional $600 payment. And then who pays for this? So currently what's in our unemployment trust, we had about $1.4 billion there that that's the employers pay in. But we're running out of money. So we've asked the federal government for reimbursements, which we can through, and then we're working on who actually is going to pay that back. But the $600 is actually supposed to be part of the CARES Act. It's going to be paid through the federal government. It's going to cover that. We still have to cover the $378 through that UI trust that we're going to borrow additional funds for.
Thank you, Dr. Healy. I think Senator Surville had a question.
Oh, there we go. You guys hear me? Great. Hey, Megan, good to see you. Hey, one of the questions I've been getting a lot is about people whose income has been partially reduced. So they haven't, for example, lost their job, but say their employers told them to take a pay cut, 10, 20, 50%. Can you describe the process for seeking eligibility if you've had a partial reduction and not a complete reduction?
Sure. So you have to have at least a 10% reduction. If you're a worker, if you're a 1099 worker, there's different ways that you can show a reduction in income. If it's the number of jobs that you have, it can be a contract that you lost because of COVID-19. And so partial unemployment is that we actually take what your weekly salary is or income. And if it is more than $428 a week, then you're actually not eligible for unemployment. You still only get your partial salary. If you actually make less than $428 a week, we subtract that from the amount 428, and you would get that extra money, plus you would still could get the $600 benefit. And so those are kind of looking at partial unemployment. So it's basically it's subtracted from our weekly allotment is how much you would get in unemployment. We are looking at other, I will say, since the legislators on here, the governor did amend one of the bills to potential bring work share. The federal government is supporting building new work share programs, and this is more of a share program between the employer and the unemployment system. And so we're looking at that as just a tool just to have in case Virginia's interested in moving forward on that. I think that's going to also help people that have higher incomes if they make more than the $428 a week.
Great. Okay, and I have one more question for you. How are we making it easier for individuals to sign up and get their benefits?
So we've expanded. So we have a new third-party call center, because the federal government you actually had to hire within the agency all your workers, and never let us have third-party call centers, but now we can. We've also increased our staff capacity. We've built this new portal for the gig workers, as well as sole proprietors. And we bought a new server. It's still that we added last Saturday to make sure the website, and then we've streamlined processes. So when somebody clicks that box, lack of work, we're sending them right to payment of benefits. We're not asking as many in and out questions. We're going to follow up with each individual when the VC can take a breath, and that's working with the employers as well, just to follow up. So we're really just trying to streamline. The other thing is about the PIN number. You used to have to get it mailed to you, then you log on to check in your benefits with that PIN. Now there's a number that you can call and just put in your social security number and say, yep, I'm not working this week. And then your benefits will come. And so there's different ways that we're really trying to streamline. But anyone who thinks that they're eligible for unemployment definitely should apply. And if you're going to apply, definitely apply online. That's probably the fastest way, not through the call centers.
Great. Well, I'm amazed at the volume you guys are pushing through with everybody contacting you and how little it was and how much it is now. You guys are doing a really good job dealing with that. So thanks for answering that.
Yeah, thank you, Dr. Healy. I had one from a constituent saying if they have a full-time job and a part-time job, if they lose the full-time job, are they eligible to receive unemployment benefits?
Yes, they are. So it's still kind of very similar to the last question about partial unemployment benefits. And so it's looking at what your income is, because every week when you're on unemployment, you have to show like an income. So that's from that part-time job, you have to document that, and then you get your partial benefits off of that. But even if you have 3 part-time jobs and you lose 2 or 1, there's still employment benefits, because any loss in income is one of the criteria that you would get some type of partial unemployment benefits.
All right, so my question is next. One of the constituents are asking what happened with individuals that have filed taxes but do not have a social security number, but they have an employer, I think, ID number. And what happened with them, Dr. Haley, and also I remember you shared something with us that was very important. When you have a part-time job and you pass certain threshold, right? There's a magic with us as well.
Just about the income. So if you make more than $428, that's the lucky number. It's the average is $378 plus $50, because you make, at least in partial unemployment, you make at least $50. That's the minimum you can make in partial unemployment. That's where the weird numbers come from. And so just as long as you don't make more than the $428, then you would get some type of benefit, and it's calculated. So you get at least $50 is the minimum for any partial. And then if you make that, so that's kind of where that comes from. As in the ITINs that we currently, because Department of Labor has not released any additional guidance of what that might look like for unemployment, we have pushed back a little bit, making sure that anyone who's especially, and this would be, if there's some guidance about if they've paid into the unemployment trust, and so that's actually the difference. So if there's some employer that they have records that they've qualified, even if they might get bumped, qualified that their employer paid into the trust in their name, then they can get unemployment benefits. But we're looking at with any type of additional records, if it's independent contractor, sole proprietors, we're looking into that as well. So again, any unemployment currently is all funded through the federal government, and it's through their regulations. And if we change in those regulations in Virginia, then our tax rate goes way up. We're at 90% off of our tax rate. It would go to a higher percentage. I think it's like 6% on a payroll. And so we are, the governor's always looking for, is there any additional funds that we can use to support people, especially during this time, because it is our priority to make sure that people can pay their rent and they can get food on their table. So we're trying to streamline as much, get benefits out as possible. This area is a little gray with Department of Labor.
Awesome. Let's see. It seems like the next question is, if I work in DC and live in Virginia, where should I file for unemployment?
So that's a great question. And so you file wherever your employer is. So it would be in DC. We had that issue when the federal government had the furloughs, were shut down, and we had a lot of Virginians have to go to DC and file their unemployment. It's still the same case now.
Thank you for that, Dr. Healy. I do have a question from a constituent. We know that only essential businesses are working. My profession is not an essential business provided workforce. I am currently receiving unemployment benefits and mandated to search for unemployment every week, although my trade is particularly closed because it's not designated as an essential business. So what advice would you give that constituent?
So thank you so much for asking that question. That's been very confusing. What we call is a work search. So usually during unemployment, it's required that you are searching for so many jobs per week or applying for jobs, and you have to track that. Governor Northam has waived that option, but sometimes there's some kinks in the system. What is also confusing, by federal law, it's required when you enroll in unemployment insurance, you're co-enrolled in our Virginia Workforce Connection, and that's where you learn about your resumes, and there's job postings. Our state jobs board is there, as well as you can kind of track your activity. during normal times if you're unemployed. And so we have waived that option, but some people still get notices that they might have to do a work search, but they still have to go into the Virginia Workforce Connection and sign up and enroll. They just actually don't have to go through the job search. So I just want to make sure that you might think it's a job search, but we're just making sure that you're enrolled in the workforce system itself. We've asked for Department of Labor guidance on that because their wording was pretty tricky. It says that states may be flexible in the work search. So, but they didn't say do it or not do it. And so then when we called Department of Labor, like, you have to do it. But then we talked to the congressional delegation, like, no, don't do it. But we are looking at, when we start reopening Virginia, we definitely want to make sure that people are looking for jobs and having the skills. And then we're going to have a lot of additional money for extra training. So if your job's not going to open, we want to make sure that you know what your new career pathway is going to be.
Thank you so much for that, Dr. Gilley. You know, one of the questions we've heard from a lot of our constituents is that the closure of the schools has just made it very, very difficult to work, and in some cases impossible, particularly when folks are the sole caregiver. Can a person file for unemployment benefits if they've had to leave their job due to that lack of childcare as a result of school closures?
Yes, yes, they can. So if a worker quit their job, when I talked about you just can't quit for any reasons, but one reason is that you have to demonstrate that the schools are closed. Interesting enough, the Department of Labor was going to require each person to get a note from their school that was closed, but thank goodness we blanket that because governor did close schools, and so there's no extra documentation required. But that can be a reason. You're not going to go fast track straight to the benefits, but you can say I quit my job, and then some of the supplement information is because I have to stay home with my children. I do not have child care, and that is a reason to receive unemployment insurance benefits.
Sorry, I'm up again. Okay. Hi. So I have two questions. One is for 1099 workers. A lot of people don't pay taxes till the end of the year because they get their income from a 1099, like an Uber driver or Lyft driver if you're an independent contractor. Can you expand some on how those people can actually apply now, and how first, I guess they weren't eligible before, but now they can. Can you talk about that a little bit more? And secondly, at least on our Facebook feed, I'm seeing a lot of questions in Spanish. And I was just curious if you could tell everybody where there's information about this in Spanish that people could find if they have questions.
Yes. So your first question is, or I can answer your second question first, just real quickly. We do have an FAQ in Spanish on the governor's website. So if you go to governor.virginia.gov, we updated it because I know Senator Sturville had it posted on his Facebook page, and we updated. We had one question that was a little gray, and so hopefully it was cleared up. So I really appreciate that. And so I can share that all FAQs and in English. I will tell you, and Spanish, with the new Pandemic Unemployment Assistance Program, we have updated the FAQ today with that information, and we're still waiting for the translation to move in Spanish. Actually, my special assistant does speak Spanish, so it was very helpful that she can she did it up real quick, and we're just getting someone to double check it. So that should be up sooner than later. And that's really with the questions are up there in fine in Spanish, just not with the additional pandemic unemployment assistance with the new program that was launched on Saturday. We want to make sure that those questions are clear, and we've cleared it with VEC. So that's a great question. About the 1099 worker, so we're trying to be flexible in many ways that someone can show income and what that might look like. It can be anything from the 1099 itself. It can be from the 2018 taxes. It can be, we're even thinking profit loss for any sole proprietors that they want to show us their sheets. I'm not sure what that looks like in our big computer system, but someone probably will individually go through that and try to build a formula off of what they think is the potential income, as well as letters from accountants even of what they think that potential person's income would be. It could be estimate, because if you want a higher estimate to get a higher unemployment benefit, and you haven't filed your taxes yet for this year, then that could be a letter from your accountant. So we are trying to be as flexible as we can. We didn't get a lot of guidance on this, so we're really just making sure that people get benefits. We still have workers that do a lot of cash. We're trying to figure out what that might look like as well, and trying to figure out, if it's a person who does lawn care or receives cash. We're trying to figure out how that's entered into the system.
We appreciate your efforts. I know it's really complicated to figure that out, especially with a whole new benefit. So thank you.
Yeah, appreciate that, Dr. Healy. One of the questions, you mentioned a PIN earlier. And so one of the questions is in relation to if a constituent has not received their PIN yet, how do they file weekly claims? And then can you kind of walk through the automated system? What is it going to look like through either the automated phone system, and how long is it going to take for people to get their PINs mailed to them? Can you expand on that a little bit for us?
Yes, and so one way is we used to, with all unemployment insurance system, after you would apply, you would get a PIN in the mail, your PIN number, and that's where you would access your account, and that's where you would say, yep, I'm not working anymore, that you would have to show that, or if you've had a change in income, if you need to update any of your account information, it's bank information as well, and your job searches. So that was all done through a PIN. We realized that a lot of people are not getting their PINs in the mail. It's just one other way we can identify a person to match a record of their address to our payroll records. And so that's basically your second match to make sure it's a valid, for fraud purposes. And so now we try to streamline that. So if somebody can apply on Wednesday, on that Sunday, they can call the number. It's on the VEC website, and there's 2 different numbers, and you can put in your Social Security number. So you don't even have to have a pen, and then you press the number saying, yep, I'm still not working, and that should move you right to payment of that week. And so you can continue to do that online until you get that pen. It's easier to do it online to answer the questions, but now we try to open up the phone lines, which is automated process, and you only need your Social Security number to actually to answer the questions, which is just through a touchpad.
Appreciate that. So there's multiple options then, both the PIN and Social Security number that people can access. That's helpful. And one follow-up question, you're involved in a lot of the governor's cabinet discussions and a lot of things that are going on. Obviously, one of the things in relation to getting around Virginia and commuting is involving driver's license. And so has there been any thinking of further extension of the driver's license renewals? I know there's been some issuance, but can you walk us through some of the thinking on that?
Yes, that's an excellent question. I know there's been constant conversation about that. What does that look like? We saw the extension, even like CDLs. And so I know we are going to extend it. I'm not sure of where they've landed so far. So hang tight. Instead of the 60 days, I think it's going to be longer, maybe 90 days. But there's still a discussion on that.
Okay, thank you.
All right, Dr. Healy. So this is a very specific, detailed question that we have here. So let me see if I can get all this information in. So it's about immigrant working families, COVID-19 and benefits. So it says that Virginia's immigrants pay over $256 million in taxes, and in Virginia, 6,700 TPS holders and 2,700 DACA recipients are essential workers during COVID-19, according to the Center for American Progress. And as of 2014, there are over 269,000 undocumented immigrants in Virginia. They are 3.5% of Virginia's population. So the question is, I guess, what else can be done in order to ensure that immigrant working families, and I guess specifically undocumented immigrants, can receive some type of economic stimulus package or financial support?
That's an excellent question, and those are great numbers. I wish I had. You please send them to me. Just as always good foundation and backup. We're always looking at ways. Some of the stimulus checks, looking at anyone who has Social Security numbers who's documented, the issues with the stimulus checks we're aware of. And so we are looking at ways in the state. Again, we're on a budget freeze. to look at. We are receiving federal dollars. There's just not been a lot of guidance of what those federal dollars can be spent on. If it's in our education system, it's to support our localities. So we are know the amount of money we get to the state, but we're still not sure of how we are allowed to spend it. So we're well aware of some of these inequities that we see of who gets benefits, who doesn't, and making sure that all Virginians are secure, economically secure. And so we are looking at that. So stay tuned. I know the governor's well aware of that, but we are, again, having local budget issues, state budget issues, and the federal government hasn't been giving us a lot of guidance on how we can spend some of the money that we are receiving.
Thank you. Hala?
Paula? Okay, well, I think, Dr. Healy, I have personally asked all the questions that our constituents have, placed in tonight, and we're closing in on the end of our conference. But I just want to thank you personally for all that you've done to inform our constituents and whomever else is watching this Zoom video. I encourage them to play it back. I do have one question. What is the unemployment website or contact information for yourself? So if they have questions, they can reach you directly.
Great. So the Virginia Employment Commission's website is vec.virginia.gov, so G-O-V. And that's where you can file any unemployment claim. Also, if you have not filed for the pandemic unemployment assistance for the 1099 gig workers, go on that website. There's a blue bar that says PUA, Pandemic Unemployment Assistance. Everyone should have gotten a text yesterday if you were denied current unemployment benefits, to make sure that you go on the website today, and that's all there as well. If you have any additional questions, I have a fantastic team that's been working around the clock trying to answer additional questions to trace down accounts, and you can email my team at workforce@governor.virginia.gov. And so governor, so it's workforce at governor spelled out .virginia spelled out .gov.
Thank you, Dr. Healy. And I want to thank all my co-hosts for
Dr.
hosting
Haley.
the call with you. And please know that we're here to our constituents, that we're ready to serve and support you. So you can also reach out to us. My number is 804-698-1051 or DELH@house.virginia.gov. Sorry, Elizabeth, go ahead.
No, that's fine. Dr. Haley, we're going to start with the questions from Facebook. I was typing them in the document as we are taking turns here. So it's one of the questions said that, is it possible for public employees to get paid overtime or hazard pay? Some states have made those concessions. Is it possible to do
Great,
it?
that's next. Yeah, that's a great question. I mean, we do follow any type of fair labor overtime pay criteria, but I know that many of our, our public employees are salary. So we have not decided what that might look like. We have asked with our congressional delegation letter, when we're looking at additional fundings, if we can have hazard pay. So the letter the governor sent last week, one of the parts of my worker section was, because there's a lot of asks I have since the federal government's printing money these days. One of them is to increase, is there any increase in hazard pay? I think it's needed. I talked about the shortages in long-term care facilities. We just have people that are not moving to the front lines where we need to. And I think it's a scary situation, but I think they should be awarded, and we should incentivize people that are on the front lines and look at the hazard pay. So we're looking into that.
Thank you so much, Dr. Haley. We're getting a few other questions online. One of them was home care workers. Can they be considered essential employees by Virginia Department of Health, and can we get them access to PPE?
That's an excellent question. I get it all the time. There's guidance from Department of Health about home healthcare workers making sure they have masks and gloves, but not the full PPE. And so I can give you the guidance on that. with the PPE situation, I think Virginia, we've been struggling for weeks, making sure that we have enough PPE for all our healthcare workers as well as our essential workers. And now we have received shipments from China in this last week. And so there's more PPE available. We weren't even having our long-term care, so it was pretty much going to all our hospitals. And so we're working, every Virginia Department of Health, their regional office has allotment of PPE that they can distribute. And home health care workers are on our list that we're trying to move up for potential more, to make sure we can deploy a little bit more PPE to those workers.
Hey, Dr. Healy, I have one more question from you from Facebook, which I think is a species of a question we've been seeing in lots of places. I think we heard it on one of our conference calls we had with you. So I want you to assume a 27-year-old person who lives in New York City, and because of what happened, they end up losing their job and they move back down here to live with their parents and file for Virginia unemployment. What benefits, if anything, would they get from Virginia? And if not from Virginia, where might they consider getting benefits?
So if they were employed in New York and they quit, they would have to apply for unemployment benefits in New York first, because that's where we'd have payroll. New York would have payroll records on them through the Unemployment Insurance Trust. And so those records, so they're more likely to get that, because you still have to demonstrate some connection to workforce in Virginia to get unemployment. If this person in the last 2 years worked in Virginia, then we could try to do something, but they would have to apply in New York first.
Great, thanks for that.
Dr. Healy, I got one that came in. Sorry, I'm accessing it through many modems or platforms. So it's going to come up, but I will redirect to Senator McPike as mine is coming up. They're still talking.
Yep. No,
Sorry about that.
So one question is, and this might be out of your area of scope and might be a more appropriate question for Dr. Carey, Secretary of Health, but you know, if I have a prescription to refill, not all doctors are doing telemedicine, and some doctors' offices have limited hours now. What is the person to do to get their prescription refilled?
So there's a little bit of guidance on refills they have. That's probably is more of a Secretary Carey kind of question. I do know some physicians are being flexible with telemedicine because people are scared to go into the offices, but not all physicians are. Even the expansion that they talked about telemedicine, that's really around other types of out-of-state work, and not specifically in Virginia that we do have telemedicine. I have told some people that are scared to go into doctor's offices, if, you know, maybe they could call their doctor's office and see if they can just stay in the parking lot and someone come out and talk to them if it's a situation that they're immune compromised. So I actually have, because I talk about safety in the workplace, right? And some people complain about doctor's offices don't seem clean, or too many nurses around me, and someone's coughing. So we do get random complaints. So that is one suggestion that we say is, you know, talk to your doctor. Maybe they can come out to your car if you have to go into for appointment.
Thank you, Dr. Healy. And finally, the question came up: can unemployment benefits be garnished by the banks for unpaid debt?
It depends on the situation. You know, if it's any way that's connected to the state so that they can't garnish your wages through like a state refund, not probably directly from private banks, and we're not connected to that system. I do say that we can garnish unemployment benefits for child support. And that is also connected to our system. So just going to make sure that those systems do, but the private banks really don't connect unless we can garnish some type of state.
Wonderful. Thank you.
Okay, and Dr. Hill, I have one more. I think that throughout this pandemic, we are all experiencing teleworking, and we are proving that it actually works. So what the administration could do to actually allow employers to do more teleworking, because before this pandemic, it was not as popular as it is now.
Yeah, it's interesting. That's a fantastic question. Moving forward in this post-COVID-19 world, business is going to look different. How we do business through telework, I think it's a great opportunity if you can get work done at home, especially when we open for business. I know I'm on the task force with Secretary Ball that's going to look at individual businesses and what states open and what's not, and moving to these large businesses, these skyscrapers, right, with all these people. It's going to be scary, and to really think about what that might look like. I think it's an important. We also have to look at that not everyone does have internet as well, and it's expensive to have cable and broadband in Virginia. We think about it's not everywhere. But there's still some people who can't afford it, and so we just want to make sure that employers can provide the best equipment as well as potential any type of making sure that there's broadband available. So it's not just workers who can afford it and some workers that can't or have other bills to pay. So I just want to make sure that's clear. But I think it's also going to increase in Northern Virginia. We have a lot of IT, cybersecurity, cloud computing. I think those are only going to grow in this area because the cybersecurity we're going to need if people are going to be remote. But the cloud computing is how we share and save information from our homes. It's all going to be important. So I can only see that the IT industry, which is booming in Northern Virginia, only increase from here on out, not just to support your region, but probably the whole country with all those jobs.
Dr. Healy, to share with us? Thank you so much for joining us tonight.
Yeah, thanks so much for having me.
Thank you.
Thank you very much. Appreciate everybody who listened in, and thank you so much for organizing Delegate Guzman and Secretary Healy for doing this with us.
And Dr. Healy, Jeremy, you go.
Yeah, thanks. Thank you, Dr. Healy, for spending time. I know you still have lots to do this evening. You've been working long days for well over a month now. So I hope you get some rest at some point, and appreciate all you're doing for the Commonwealth.
Yeah, and Secretary, Dr. Healy, I want to say the same thing. I cannot imagine having to do my job where the amount of people asking me for service increased by a quantum of about 100,000 over a couple week period. So you're really doing a lot of work for all of us in the Commonwealth. We all appreciate everything you're doing, and especially taking the time away from your family and your job tonight to inform our constituents specifically about how they can benefit from your services. So thank you very much.
All right, so I have a couple of notes here that I got through the Facebook Live. It's talking about Tara Gibson. It says unemployment insurance for those who are staying home to take care of their kids is essentially paid leave. It's exciting to see federal paid leave provisions in both FFCRA and CARE Acts. Then there's another comment from Lillian Gutierrez. Of benefits with ITIN number or the IRS number. I think that Dr. Haley answered that we follow right now the regulations from the federal government. So until they change that, we're gonna work through that. I don't know if I'm correct or not, Dr. Haley. Please just feel free to step in if that's not accurate while I am summarizing here. So with that, we're gonna conclude this town hall. And just would like to thank everybody who joined us tonight with the Prince William County delegation, Dr. Healy, and everybody who's watching us on Facebook Live. Please stay tuned for our next town hall Tuesday, where we're gonna partner the Prince William County delegation. We sent the invitation to the Fauquier delegation. We're partnering with the Chamber of Commerces from both counties. And we are gonna have our special guest, the Deputy Secretary for Commerce and Trade. So thank you so much, everyone, for joining us, and we all see you next week. Thank you.